Hello, everybody. Welcome to another question of the day. So today's question comes from my 9-year-old son, Graham, and he wants to know, is Brazilian butt lift surgery dangerous? Now, where would my 9-year-old know to ask that question? Oh, he watches Botched. Yes, my boys watch Botched. It's like one of their favorite shows. And who am I to shelter them from it? It's the real world. So listen, I've touched on this one before, Graham, and I'm not going to get into statistics and all kinds of crazy stuff right now because I've done this one, but let's just touch on what are the risks and why is this in the media and what are people talking about? So Brazilian butt lift, we all know, is fat transfer to the butt. It's as much of a surgery of injecting fat into the butt as it also is the liposuction. So the principle of subtraction, where we actually take fat away to sculpt the body, is really, really important. And we then take that and we inject that back into the gluteal region into safe areas. So why is it supposedly so dangerous? It's dangerous because if we inadvertently inject fat into a large blood vessel, it can go back to the heart and it can cause death. However, if you know what you're doing and you stay subcutaneous above the gluteal muscle and we only inject fat into fat areas, then you're pretty darn safe doing it. And we know that because I have plenty of friends who've done hundreds and hundreds of them with no problem. While the death rate is slightly higher than other procedures, I still do think it's a safe procedure if you're a good surgeon and you actually follow the principles. Not that something bad can't happen to a good surgeon, because it does, but if we follow some of the main principles of injection by injecting only subcutaneously into the subcutaneous fatty tissue, we stay away from the inferior gluteal vessels, we stay away from the superior gluteal vessels because we know where those are, you can do this operation very safely. And I have to tell you, it's actually become one of my favorite surgeries because the results can be so amazing when it's done well. So pick a surgeon who knows what they're doing. The reason we've seen a lot of this in the media is because partially, I think what we've seen is people are getting overzealous and trying to do 2, 3, or 4 in a day. They have PAs doing the lipo and the injecting and they're not in the room. That's not an operation that we want to rush through. You do 1 or 2 in a day. They're long operations. You do them safely, you do all of the procedure yourself, and it can be a very safe procedure. As I stated, every surgeon, good or bad, can have a complication. It happens, it's surgery, it's risky. But if we adhere to some of the really, really safe principles, fat grafting or BBL surgery can be a very safe operation. Graham, thank you for asking that question. I think a lot of people out there are going to benefit from your question. Again, you guys asked the question and I will answer it. Have a great day.